Today we're going to be going over how to prepare for your final clinical rotation in physical therapy school. If we haven't met before, my name is Alex Grodzicki, and I just graduated from Central Michigan University's Doctor of Physical Therapy program this past May. And I want to share some of my tips as well as how I got the most out of my clinical experience. How did I prepare for my final clinical rotation? I think the big thing here is doing a quick overview of everything that you learn in PT school and trying to pick 1 to 5 different things that you feel like you could use a little bit of refresher on. One of the things that I found that I needed a refresher on is special tests. I also felt like those would be something really clinically relevant when going to an orthopedic setting. Those would be my suggestions, and that's how I prepared for my clinical rotation. You can expect to gain a wealth of knowledge to start becoming your own version of a physical therapist that you've always wanted to become. You can expect to learn new techniques and ideas that you didn't even learn in class, so that you can start getting interested and excited about learning things in the future. One of the things that I want to learn more about is vestibular work. I really enjoyed it in the clinic. And lastly, you'll be able to learn what you do and what you don't like in a job. So that way when you're looking for a job in the future, you'll know. Some good communication strategies to help set up those final clinicals is number 1, you're going to want to have open communication. Always let them know what's on your mind. And number 2, probably the biggest one, is ask frequent questions. Don't be afraid to ask something even in front of a patient, because patients love to hear what's going on behind the scenes. They want to know a little bit more about their pain, and by you asking those questions, it opens the doors for them. How did I manage this final clinical craziness? What I did was I set a little bit of time aside so that I could create a plan. That way I knew if I was taking my licensure exam in July or April, and I think that's the big one, and it can save you a lot of time and frustration if you make that decision now. Going off that last question and jumping into this question, I decided to take my boards in July because I just found it too challenging to try and work a 40-hour work week while trying to study for this big test. Some of the test prep material that I decided to use was the Score Builder's book, as well as Score Builders has what's called Basecamp. And what that does is it helps to break down the book a little bit more so you're not reading page after page. Some of the other study material that I used was podcasts, great for learning while you're exercising, was the PT Final Exam podcast, and they also have, you can sign up for their emails. So about 3 days before the test, what they do is they'll do like a webinar, so you can join like their Zoom meeting, and their Zoom meeting will just pretty much go over as quickly as possible like the highlights of the NPTE and the most common questions that you may get. Lastly, I use another podcast that's just an NPTE podcast, and if you look up NPTE on Apple Podcasts, you'll find a bunch of them. There's so many materials out there, find what works best for you. My last few tips that I want to share with you is number 1, enjoy your clinicals. They're so much fun and you're going to learn so much out there. Number 2, be a sponge. Try new things. Get excited to learn new things and just absorb everything that you can from all your clinical instructors and every single day that you're there. I wish you the best of luck through all your clinicals and the start of your career.